Welcome to Eldercare Illuminated, Torchlight's caregiving podcast. Eldercare Illuminated addresses the ins and outs and ups and downs of caring for your loved ones. Join us for interesting conversations with eldercare specialists, geriatric care managers, attorneys, and ordinary people with extraordinary caregiving experiences.
Welcome to today's episode of Eldercare Illuminated, brought to you by Torchlight. I'm your host, Lenore Tracey, and today we are so lucky to have attorney Cathy Sikorski back with us. Cathy is an elder law attorney, advocate, writer, and humorist. With today's topic, however, there is little to laugh about. We are going to be talking about Medicare's skilled care coverage and a major misconception that has been around for many years and is still a barrier to many Medicare patients getting the services to which they are entitled. Specifically, we are going to be talking about skilled nursing care and skilled therapy services in a skilled nursing facility, in a home health setting, or as an outpatient. Cathy and I are both very excited to be part of the effort to get this information out there and into the hands of Medicare subscribers and their caregivers. Welcome, Cathy.
Thank you, Lenore. Yes, I'm very excited to talk about this because the more we get the message out, the more people will get the care that they deserve, they need, and that they're entitled to.
So, Cathy, let's start with an overview of skilled care coverage in Medicare, just to set the scene for our listeners.
Okay, so skilled care coverage basically means what kind of care you would get or you would be entitled to in a skilled nursing facility, which is often called a SNF, SNF. So if you see, they love acronyms in Medicare. And if you see a SNF or you hear the word SNF, that's what they're talking about. And primarily in this case, we're talking about people who are in a skilled nursing facility and have either gone there for rehabilitation purposes straight from a hospital and are now under Medicare payments because they have somewhere between 1 and 100 days of eligibility to be have their medical expenses paid for by Medicare because they need rehabilitation expenses. Or you could, in fact, be in a skilled nursing facility and you're receiving therapy services, occupational therapy, physical therapy under certain circumstances that Medicare would pay for. And so that's the kind of a situation where what we're going to talk about today, often people are denied services inappropriately or wrongly.
And Cathy, that's also true in outpatient, isn't it?
It is. You mentioned in the beginning that there are situations with home health care as well as outpatient care, and that primarily falls into that physical and occupational therapy setting, where your loved one, if you're the caregiver, is receiving some kind of therapy in order to continue to be physically capable to stay in their home or to just improve after some kind of a setback or to just stay healthy. And those services don't have to be in a skilled nursing facility. It can be in a home health situation or just that you take your loved one for therapy.
Good to know. And I learned a new acronym just this week, IRF. I had to look up what that was. Inpatient Rehabilitation Facility.
That's new, even though, of course, it's a thing. That's a new, honestly, acronyms. If you don't know acronyms, I swear you can't even talk the talk in this world of caregiving.
So that's a new one for our listeners to understand and for me to get under my belt. Okay, so Medicare's been around for a long time. What were caregivers and patients experiencing before this case that we're going to be talking about? So what was a kind of typical interaction or typical expectation?
So before this case, and I experienced this personally as a caregiver, you would have your loved one, your caregivee or caree that you're taking care of, either in a rehabilitation situation or in a situation where they're receiving skilled nursing care or therapy, and the facility or the therapist would tell you, I'm sorry, we're going to stop services now because your caregivee is not improving. There is no possibility for them to improve from the place that they are right now. And so they are no longer entitled to service.
Another word that I heard used frequently was plateaued. You have plateaued. You've gone about as far as you can
exactly
go.
The word. So no matter how much work they've put in, we don't think any more work is going to get them to a higher level of functioning, and therefore all services will now stop. And you are no longer entitled to care. And then either they would send you home from rehabilitation, so you would not be able to stay in the rehabilitation aspect of the facility, even if you weren't prepared to take your loved one home because you didn't think they were ready, or they would stop the actual physical and occupational therapy. So for an example, my brother-in-law had multiple sclerosis, so he was very severely impaired with his hands and his capability to, lift utensils or his drinking glass or whatever. And they said, I'm sorry, he won't get any better, so we're going to stop. And so, of course, as you can imagine, Lenore, as with many patients, he would backslide because he no longer had consistent therapy to keep what he had attained. And it was a horrible way to treat people, especially people who had degenerative type diseases, who were definitely going to get worse.
We're not talking about elite athletes here. We're talking about helping people continue to be able to walk or to feed themselves or to use technology, get dressed. That's right. Put their shoes on in the morning.
Yes,
so
exactly. And they would backslide, of course, because they no longer had the services to help them stay strong and stay consistent.
So this went on for many years, many years.
So in 2013, several organizations, one of them, for instance, being the National Multiple Sclerosis Society, and 6 individual beneficiaries of Medicare sued Kathleen Sebelius, who was the Secretary of Health and Human Services at the time. And that famous case is called Jimmo because Glenda Jimmo from Vermont was the primary plaintiff. And it included 7 national organizations. The point of the lawsuit in Jimmo versus Sebelius was to sue for what was actually the standard was that Medicare just had to take care of you in a skilled nursing facility and provide skilled nursing care if you qualified for it, period. But somewhere along the way, somebody developed a standard that said they have plateaued and they are no longer eligible for services. This wasn't written anywhere. This wasn't a part of the laws or the standards or what the Centers for Medicare and Medicaid Services assumed were the case, but it became a standard practice.
It's amazing.
And what's interesting is, of course, when they would submit the bill for Medicare payments, Medicare would deny them based on this concept of plateau. And CMS, which stands for the Centers for Medicare and Medicaid Services, who is kind of the ruling law body over what are the rules, what are the regulations about Medicare, was going along with this. And they would refuse and deny claims. And people would appeal one-on-one, and they would win occasionally. And I actually had one of those personally myself that I did. But, I know what I'm doing. And I'm just one person trying to help one person. The truth of the matter is this case was, in fact, an abuse of what patients in Medicare were entitled to. And so in 2013, there was a settlement, the Jimmo versus Sebelius settlement, where it was agreed that plateauing or lack of progress is not the standard. The standard is, do you need the care to either stay at where you are or to maintain what you have already accomplished? And the Centers for Medicare and Medicaid Services were required to put out a campaign to let nursing homes and medical providers and therapists know that the standard is not a plateau and then services end. And for 4 years, nobody did anything. And in 2017, the attorneys, the executive director for the Center for Medicare Advocacy went back and said, you are not doing your job, CMS, Centers for Medicare and Medicaid Services, and they sued again. And in 2017, so that is 1 year ago, which is why for you and I, it's a hot topic and I told you, and we'll revisit again, what happened when I went and spoke to lawyers who work in this field. 1 year ago, CMS was required again to put out FAQs and, frequently asked questions and an improvement standard letter so that everyone would know what the standard was and that this would no longer be happening to Medicare patients.
Did that actually happen?
Well, they put the information out. The question is what's happening now practically. So I am an elder attorney and I go to elder conferences, and as a little test, because you and I were just talking about this ourselves, one day, and I said to you, I'm going to ask what's going on. And I asked every attorney I ran into, dozens of attorneys. I said to them, so tell me what's going on with the GMO settlement with your client. And they said, nothing. And I said, well, what do you mean by that? What do you mean nothing? And they said, well, if our clients tell us, if the caregivers tell us, that there's a problem, we will contact the appropriate facility or therapist or whatever. But the facilities and the therapists continue to absolutely deny and stop payment if someone has a non-improvement standard or a plateau. That continues to be what's going on. And so you and I jokingly said we need to make a little laminated card, right, that people can carry around with them, showing the corrective action has been taken. And CMS did publish a new web page containing important information. They claim that the corrective action has been taken. People living with chronic diseases like multiple sclerosis, Parkinson, Alzheimer's, other long-term conditions are still fighting this battle, but they should be on the winning side. And I believe with just enough information in their hands and being a self-advocate, which you're a caregiver, I already know that you are, you're the advocate. I think you can overcome these problems if they're happening to you.
I think it is so important. I mean, we joked about a laminated card. I think that's not a bad idea, but this is a soapbox. And when this podcast is published, we will include links to the CMS FAQ page and to some of the other information that you so kindly provided, so people will be armed. And I think it's very difficult. We talked in an earlier podcast about the patient-doctor relationship and how hard it is to question a provider. And this misconception is being continued by the provider. So you've got to say that's not right to somebody who's providing care for you. And that's an awkward position to be in. I have a friend who over the summer, late spring, she was having some difficulties with an arm, with using her right arm, and she was sent to physical therapy, and she ran into exactly this problem. And she said to the physical therapist, no, my friend Lenore told me that this isn't right.
Yes.
And I sent her a variety of links. I sent her some materials from the Center for Medicare Advocacy. And well, she's a character, and she carried on and she prevailed, but not everybody is in a position to do that. I mean, they're temperamentally or, people are anxious about questioning their provider. So it's so important. And maybe it's a little bit easier if you're the caregiver and you're not the patient.
Correct. But so the question then becomes, what can you do and what can we do even as people in this field? And I think number one, it's almost like every other awareness, breast cancer awareness, right? Making people aware, number one, is truly, truly important. And so I would love to know that people at Torchlight are having this conversation amongst themselves, amongst employees, are you having this trouble with your mom? Because I'm having this trouble, with my mom in therapy. They won't do that and she's not walking anymore, whatever. Number one, start the conversation. Number two, take this information, these links that you're going to provide, and print them and have them and carry them with you. And when you don't get a result from your therapist, you need to talk to your therapist's boss. You need to talk to the head administrator of the nursing home. You need to take this up to the level where these people are decision makers, because my guess is, Lenore, believe it or not, they know that, but they're not disseminating the information. It's not trickling down to the actual literal provider.
I think that's absolutely true. And as wonderful as it is that CMS has put a FAQ page up and put explanations up, you have to go there to see it. And frankly, you've got to be looking for it. It's not on the front page of their website. And it's not on the front page. I actually think that the Medicare.gov website is a great website. It's easy to use. I praised it and I sent people there, but there's nothing there that would give you this information. It would be great if when people signed up for Medicare, or even at annual enrollment time, which is coming up, October 15th to December 7th, if there was a little reminder of some of the more picayune issues, and this could be considered a picayune issue, but it isn't if you're the person who needs the help. Just a little like, these are some things to watch out for. These are some things to think about when you're getting these kinds of services. Really, really important. I ended our last time we talked to tell listeners to eat nails for breakfast. Like, that's a terrible thing to say to people, but you've got to be tough. And it's just like when you're talking to the cable company or the electric company. Okay, I'm sorry. May I please speak with your supervisor? It's tough to do that.
Exactly.
But I really encourage people to do that. And you print out the information and you bring it with you and you leave it with them, and you have to be the squeaky wheel. So we're talking again about advocacy, but that's for caregivers. That's probably the most important thing that you can do.
It's probably 80% of what you do when you're talking about a medical bill that you're fighting, when you're talking about medical care that you want or don't want for your loved one. You're an advocate almost all the time. That's really what you're doing. And interesting, the Center for Medicare Advocacy says that even though, this important message about GMO has been put out there by CMS, in practice, providers and Medicare decision makers who erroneously believed before that the beneficiary had to be expected to improve, meaning the patient, the new education and the web page are important because many healthcare providers still operate under this misconception. That's straight from the horse's mouth. Unfortunately for us, we need to be the ones who bring the information to them. Fortunately for us, that information is coming from the source. And all they need to do is check it. And I would say, even as an attorney, I bring this information to an administrator of a nursing home or the head of a PT or OT company to say that this is, what the standard is. I'm thinking legally, they're not going to want to mess with that. Either A, don't know it, or B, they haven't provided the information to their actual providers.
So if you think that your loved one is not getting the care that they're entitled to, and you think that the GMO standard is not being followed, and you have gone to maybe the physical therapist, and then you've spoken to the supervisor, you've spoken to the executive director of the skilled nursing facility, and you're not getting anywhere, exactly what can you do?
You can appeal. You always have the right to appeal a decision that negatively affects your medical care. And because basically they're saying Medicare won't pay for this. That's really what they're telling you, right?
Yep.
So they have to create a denial from Medicare. You say, I want the service. They have to deny it from Medicare, and then you can appeal. You have the right to appeal. Just like if they try to send your loved one home from either the hospital or a nursing home, you always have the right to appeal that if you think it's appropriate. People don't like to do it. Now you're entering into the quote, legal process. But it's not as complicated and as hard as you may think, believe it or not.
Do you need an attorney to appeal it?
No. Can I honestly tell you, and often I'm the first person to say you need an attorney for this and that, and I don't recommend doing it on your own, but not in this case. The law is on your side, and it's so clear. You do not. You know how you get these papers all the time that says you have 180 days to appeal this, and they, you get the EOB from Medicare. Yep. Says this service has been denied, and they tell you exactly what to do. It's all right there. And it doesn't even have to be legalese. You can just say, I am the caregiver for my mother, and she continues to need this care for her services so that she can maintain her level of capability. Honestly, it's as simple as that.
And during the time, so you fill out the information, and I believe that on the Medicare.gov site, this is all there, easily accessible, and you file the appeal. During the time that it's being considered, are services suspended, or do they continue to be delivered, or is that
They're supposed to be delivered. And again, that's going to be a conversation with either if they're in a skilled nursing facility with, the director there, or it's going to be a conversation with the home health people or the physical therapists who are coming to your house or you're going to them, that you want these continued while you're appealing. Usually they'll do that because they know they'll get paid.
Yeah.
It's all about them getting paid. Let's be honest.
It is a mysterious thing. It's all about money. But
it is.
For caregivers, it's all about doing the best you can and doing right by the person you're taking care of. And Medicare is an entitlement, and working people pay into it.
Yes. I would say to your listeners, please don't be afraid to these documents that you're going to attach are so powerful. Don't be afraid to use them, because I think you would be shocked at how easy you will get the results you need. I don't think it will be as difficult, but you have to bring attention to the fact that you're still entitled to these services.
We are going to make sure that this conversation gets around. I am so glad we have recorded it. Listeners, if you or a loved one have been told that they are no longer entitled to PT or OT or speech therapy or skilled nursing care because they have plateaued or because they're not going to get any better, get in there and advocate for your loved one. I was going to read just a quote from CMS that just says it all in 2 sentences. Skilled care may be necessary to improve a patient's current condition, to maintain the patient's current condition, or to prevent or slow further deterioration of the patient's condition. A beneficiary's lack of restoration potential cannot in itself serve as the basis for denying coverage under these benefits. That's it.
Amen.
2 sentences.
Yes. Yeah, 2 sentences.
2 sentences. Thank you for joining us for this episode of Eldercare Illuminated. If you don't have Torchlight available to you as an employee benefit, ask your employer to contact us and learn more how to bring caregiver support into the workplace. Our website is torchlight.care. We will include links to the Center for Medicare Services. What is CMS again? Center for Medicare
and Medicaid Services.
And Medicaid Services. We will include 2 links to the most important pieces of information for you. And in the meantime, get out there and take care of yourself and take care of your loved one. And we'll see you on the next episode of Torchlight's Eldercare Illuminated podcast.
Thanks for listening to Eldercare Illuminated, a Torchlight caregiving podcast. Find other episodes of Eldercare Illuminated on iTunes, Spreaker, and Podcast Go. If you're interested in bringing Torchlight Elder or any of Torchlight's other caregiving products to your workplace, please contact info@torchlight.care. That's info@torchlight.care.